An interesting case that we recently seen was on one of our colleagues, an anesthesiologist in his 45, no cardiovascular risk factor, was quite fit, having jogging almost every morning, that suddenly one morning while shaving he had a flash pulmonary edema. He realized that, he treated himself with intravenous furosemide and went to the emergency room. At the first ECG, he had atrial fibrillation with a high heart rate, and we performed a quick echo using our V-scan to realize that he has a severe mitral regurgitation with likely a flail of the posterior mitral leaflet. The patient underwent also CT to check the coronary arteries that were clean. So the patient was stabilized and transferred to our cardiology ward, and after a couple of days he had his transthoracic and transesophageal 3D echocardiography and underwent successful surgical valve repair with full recovery. So ECG was the first line, and we saw that there was a high rate atrial fibrillation. This may be as well a cause of flash pulmonary edema, but it's quite unusual that in such a young patients otherwise well could have this high atrial fibrillation. So we needed some imaging to check the function of the heart, and this was critical to detect severe mitral regurgitation, dilated atrium, that it is the pathophysiological basis of atrial fibrillation. And then at 45 years of age, despite no cardiovascular risk factors, you should critically exclude coronary stenosis as another cause of atrial fibrillation. This was done very quickly in the emergency room with the CT. So the patient had a proper diagnosis already in the emergency room. What we needed just to assess better the anatomy of the mitral valve, this was done in the ward, just to provide the cardiac surgeon with the essential informations to proceed for valve repair, and this is the invaluable help of 3D echocardiography.